Hi everybody, this is a quick video about treating vitamin D receptor resistance. I've posted a couple of videos about this before. I've interviewed one of my colleagues from out in BC, Dr. Sandhya Tamburik, naturopathic doctor, on my Overcoming Chronic Illness podcast about this topic of vitamin D receptor resistance, where essentially there are issues with the vitamin D receptor, and even though there might be plenty of vitamin D floating around in the bloodstream, the receptor is not transmitting the signal to the cells to do all the work that vitamin D triggers vitamin D receptors to tell the cells to do. So we effectively have a vitamin D receptor, rather we functionally have a vitamin D deficiency on a cellular level, even though there's plenty of vitamin D floating around in the bloodstream. So quite the conundrum. So someone posted a question on one of my other videos asking whether or not it would help to minimize some of the potential side effects of the elevated blood calcium levels that could occur at certain higher levels of vitamin D when folks are treating this vitamin D receptor resistance. So it's a great question. We know that vitamin K2 is important for helping to make sure that the calcium in the blood is utilized properly, making sure it's getting into bone tissue, etc., and not just kind of moonlighting in the blood. So it's a really good question. While I don't profess or pretend to speak for Dr. Tamburik, when I have communicated with her outside of our podcast, because I don't think we touch on this in the podcast, and the person asking the question was referencing the podcast, and I believe she's listened to it. So in a previous communication I had with Dr. Tamburik, who has lots of experience treating vitamin D receptor resistance, she, I believe, relayed to me, if I understood her correctly, that vitamin K, it's not actually part of the kind of official vitamin D receptor resistance treatment protocol, that it's fine to have it in there, but it's not really, hasn't really been found to be a key component of it. And so what I took from that is that it doesn't really require vitamin K for the protocol to work, and nor would it really help to mitigate symptoms or side effects associated with higher dose vitamin D necessarily. So again, that's just my understanding from that communication with her. Treating vitamin D receptor resistance is something that's been newer in my practice in the last several months. So I'm not an expert in the topic. I'm in the process of hopefully becoming an expert in the topic, but I'm not there yet. So I certainly defer to Dr. Sandhya and others who have more experience than me. So thank you for the question. I hope that this answered the question. If not, just post in the comment section below and I'll try to clarify it in a future video. If anybody has any questions about this topic or anything else, just post in the comment section below and I'll answer as soon as I can.